There's the occipital bone. There's the suture between the mastoid region of the temporal bone and the occipital bone. There's the suture between temporal and parietal out here. Okay, this is pretty tedious part. This whole area is the petrous portion of the temporal bone. Okay, so there's a lot of ear stuff in there. Okay. The external acoustic meatus, the ear hole that we saw from the outside, is underneath. It's underneath right there. There's a ridge. Remember, there was a ridge that separates the middle cranial fossa from the posterior cranial fossa, running right along the top of this petrous portion of the temporal bone. And there's a groove in that ridge for something called the superior petrosal sinus. And we will see that when we open up the skulls. Okay, some really teeny-weeny stuff. There's a little hiatus down in here for something called the lesser petrosal nerve. And then there's another groove right behind it for something called the greater petrosal nerve. And we'll actually see those, or pretend we see them when we get inside there. This area here is known as the tegmen tympani. Okay. There's a bulge here known as the arcuate eminence. This area out here. Again, this groove on the top is pretty obvious. And I'll say that area separates the middle cranial fossa from the posterior cranial fossa. There's a little hole down here in the back. This is the mastoid region. The mastoid process is behind there. That little hole known as the mastoid foramen, which you may or may not find. Okay. On the outside of this temporal bone, which you can readily see, there's that hole, which is the external acoustic meatus. It's the outside hearing hole, right? The outside hearing tube, or outside hearing hole. Okay? There's one on the inside, the internal acoustic meatus. So what happens is that sound comes in that external meatus, hits the eardrum hits the three little ear ossicles, and then they send all sorts of crazy things happening to the fluid in the inside. The nerve, the cranial nerve, the eighth cranial nerve that's concerned with hearing, comes from the brain and goes through the internal acoustic meatus and picks up the signal that ultimately came from the eardrum at the external meatus via all sorts of little bones and fluids and stuff that we'll talk briefly about later, but not in great detail, because you're not audiologists. Okay, there's a depression here known as the trigeminal impression, and that's where a big cranial nerve, the trigeminal nerve with three parts, is going to sit, and to send one part forward and one part down through there, and another two parts forward actually, and another part down through there. This area on the front end, right where this temporal bone runs into the sphenoid up there, and that big gap is the foramen lacerum, is known as the apex of the petrous part of the temporal bone. This is all from the inside. We saw it again from the lower side yesterday. Yet another view in living color. Okay, once again, grooves on the inside of the skull from the middle meningeal vessels. Managing to get around. Okay, there's this petrous portion of the temporal again. There's that groove for the superior petrosal sinus. There's that area known as the tegmen tympani. That little bulge known as the arcuate eminence. There's the internal acoustic meatus, right where the eighth cranial nerve is going to go in there to pick up all the hearing sounds. And then there's a big groove at the back of the temporal bone, and that's for the sigmoid sinus. The brain is drained by these sort of just openings in dura, which are called sinuses, cranial venous sinuses. They come down and they have a fancy pathway that goes horizontal and then has this S-curve as it passes through the back of, or the inside of the back of the temporal bone. That's where the sigmoid sinus lies. And then all that blood drains down through the jugular foramen, which is this hole between the occipital bone and the temporal bone. And you can see that on the bottom of your skull, and you can see all this stuff on the inside of the cranial cavities there. It's just to the side of the foramen magnum, which is right there. Okay, moving on back. So here's all this stuff on the temporal bone again. Right, there's the back of the sphenoid, where the sphenoid is sort of fused to the occipital bone. So there's the spheno-occipital synchondrosis. There's that groove for the superior petrosal sinus. So that's another one of these venous drainages. There's the opening, the internal acoustic meatus, where the 8th cranial nerve goes through. There's another groove for another sinus, running right between the petrosal bone and the occipital bone, known as the inferior petrosal sinus, another one of these venous sinuses. And that big hole, the jugular foramen, where the jugular vein goes out. Foramen magnum, this is foramen magnum. You're seeing half of it. Going out the side, over there is the hypoglossal canal. We saw that from the underside on Monday. Here's that sigmoid sinus again, going to the jugular foramen. Here's another one of these venous sinuses. So we saw in the front, we saw a little groove right at the beginning of the frontal bone, a little groove for something called the superior sagittal sinus. And it's going to come out and arch over the inside of the skull, inside of the cranium. And it's going to go to the back. So it's going to start right here, run all the way the inside of the top of the skull until it ends up at the back right here, where the superior sagittal sinus comes in. And then part of it's going to go to the right into this thing called the groove for the transverse sinus. Then it's going to dump here into the groove for the sigmoid sinus and then go out through the jugular foramen. Okay, so this is all these venous sinuses. And before it goes out there, it's going to pick up blood from this inferior petrosal sinus and then this superior petrosal sinus, and they're all going to dump in and eventually get out through the jugular foramen. These big depressions on either side of the foramen magnum are known as the cerebellar fossae. So the cerebellum, that little thing with all the lines on the bottom of the brain, lies right in here. Okay? If we look more on the occiput, there's this internal occipital crest. So this sort of a ridge, sort of bordering the cerebellar fossa. Then there's the internal occipital protuberance, so where this ridge runs into a bump, known as the internal occipital protuberance. Again, groove for the transverse sinus. You get the whole areas of cerebellar fossa. This area here is called the confluence of sinuses, because your superior sagittal is coming over from the top, the transverse sinuses are going out from the side, and then there's another little sinus known as the straight sinus that's coming in there from somewhere up there. So mostly what we're seeing down here is the groove for all these venous sinuses. And I think we've covered all of the things there. And you can see all that on the inside of the skull. Okay, the occipital bone from the midline, looking laterally. Again, cerebellar fossa. Above the cerebellum is the occipital lobe of the brain. So this is the cerebral fossa. Okay? And there's that groove. They're separated by this transverse sinus. And there's going to be a big sheet of dura that's lying right just like that, but we'll worry about that later. Foramen magnum, and going out the front side of the foramen magnum is the hypoglossal canal. What goes through the hypoglossal canal? Wild guess.
Hypoglossal nerve.
Got it, hypoglossal nerve. Okay, there's the occipital condyles that articulate with what? Don't all speak at once. The atlas, the first cervical vertebra. Okay, so all we're seeing is these grooves. There's the transverse sinus, sigmoid sinus going down there, jugular foramen over there, hypoglossal canal, foramen magnum. Okie dokie, moving right along. Okay, gee, we're back on the front again. Our old friend the maxilla, there's the teeth. You guys know all these teeth, don't you? What are these first two? Followed by?
Canine.
The what?
Lateral incisors.
Central, lateral.
Canine. Premolar.
Oh, good. They're not bicuspid. They're premolar. Good for you. And these guys?
Molar.
Oh, good. Okay. So this is stuff we saw on Monday's lecture or Tuesday's lecture, or whatever. The anterior nasal spine, right? The bottom of the nasal opening. Okay. There's the nasal surface. That's the inside of the maxilla there. There's the midline. Right, there's the hard palate formed partly by the maxilla, partly by the palatine bone, the maxillary tuberosity in the back, the alveolar process where the roots are sitting. This little groove going through here is called the incisive canal. This broad area is known as the palatine process. It's part of the hard palate that's connecting the maxilla to the palatine bone. And that's all. We saw this previously, and we've seen it from the outside to some degree. Okay, so we're into the nose. And as I mentioned before, this is the nasal septum, right? So this keeps stuff going up the right nostril from joining stuff from the left nostril and vice versa. And this nasal septum, as I said, has three parts. There's a bony part coming down from the ethmoid, a bony part coming up from the vomer, and then a cartilaginous part in the front. And that's what they look like when they're intact. The vomer part down here, perpendicular plate of the ethmoid up there, and the septal cartilage in the front part. There's the back of the throat. What's this area called? Pharynx. Okay, yet another view. Okay, so if we got rid of this septum, and then we're looking at the inside of the nose, not from the midline, but the sort of the wall area. Here's our sphenoid, which has actually just been added in because the sphenoid would be back here. That's where the sphenoid would be. So there's the sphenoid sinus you're seeing in half view. This is the sella turcica in cross section. Okay, these are these superior and middle conchae. Right, these turbinates, these scroll-like things that you see if you look through the nose. So these are attached to our ethmoid up here. Okay, there's the inferior turbinate or inferior concha down there. This is maxilla. We'll get this labeled in a minute, I'm sure. This is the rest of that palatine bone. All we've seen before was the part in the midline, but this is the horizontal part of the palatine bone. This is the vertical part of the palatine bone. And is it going to be labeled? Ta-da! So there's our palatine again, the vertical part of the palatine. We'll get into that in more detail later. Inferior nasal concha, the ethmoid part, the superior middle nasal conchae. There's our little lacrimal bone, right? We're looking laterally towards the orbit. So there's the lacrimal on the medial border of the orbit. There's the nasals up there. This is a nose-eye view of the side wall. There's the palatine, maxilla, sphenoid in the back. So this is what the inside of your nose looks like. We're labeled, as we've said before. Superior nasal concha, middle nasal concha, inferior nasal concha, horizontal plate of the palatine. We'll get to that later. Sphenoid, sinus. Okay. Holes. The sphenoid sinus, just like the ethmoid sinuses, has epithelium in there, and it can make mucus and stuff, and the stuff has to get out, or you want it to get out. And so this, and has a hole in the front of it, which is the opening of the sphenoid sinus into the nasal cavity. Okay. Here is a hole. Oh, this is going to get messy. This is an opening known as the sphenopalatine foramen. It is known as the sphenopalatine foramen because it lies surrounded partly by the palatine bone and partly by the sphenoid bone. And when we get into that pterygopalatine fossa that I talked about briefly the other day, this is going to be how stuff gets out of the pterygopalatine fossa into the nose. So that's the sphenopalatine foramen. Remember that. We're going to see it from the outside in a few minutes. And here's our pterygoid plates again, right? The medial plate, the lateral plate, and coming off the medial plate, this little protuberance known as the pterygoid annulus, which you can all see that from the bottom. God, this goes on forever. Okay, the parts of the palatine bone. This is the horizontal plate of the horizontal plate of the palatine. We've seen that in 6 different views, right? We saw it from the underside. We saw it from the back. Now we're seeing it in cross section, and this vertical part is known as the perpendicular plate of the palatine. Okay, so it forms the back part of the hard palate. It forms the back wall, the back medial wall, or the back lateral wall of the nasal cavity. And then we're going to see it again because up at the top it forms a little bitty bit in the back of the orbit. Okay, and all the parts of the sphenoid that we've seen before. No,
That's it?
Be true. Holy cow. Okay, well that's it for internal features of the skull. There will be more on, what's today? Wednesday? Friday. Okay, does anybody have any questions?
Everything.
Great! So you're all set for your practical and practice quiz on Friday. Okay, obviously a lot of what I showed you is very, very hard to see from an intact skull. So you're welcome to spend as much time this afternoon as you want going through all of this part. You're welcome to look at the ones in the back or the individual skull bones. But I urge you to look at atlases where you can see these things broken down. Okay? I know this is a mess, but we're trying to get you to have some feel of the 3-dimensional morphology.